Hello, everybody. Welcome to Hygiene Elevated Conversations and Innovations. We are so honored to have with us today Nichelle, a hygienist who's making a huge impact in her community. Nichelle, thank you so much for joining us.
I'm so happy to do this with you guys. Super excited.
Nice. And we've got co-hosting today. We've got the one and only Joffrey.
Hey, good morning, everybody. Nichelle, we are so thrilled to have you on the podcast today. Would you please tell us your journey into dental hygiene?
Yeah, my journey is kind of all over the place because, as a child, I was always loving going to the dentist. My sisters hated it, but I loved it. I wanted to get my balloon. But the actual dentist that I had here in Las Vegas, he was the first Black dentist in Nevada. And so he actually ended up being in the history book, the Nevada history book. Actually ended up going to the elementary that was named after him. His name was Dr. McMillan. So I really think seeing someone, that looked like me in that position, I was kind of like, I want to do something like that. But as the years go, our mind changes, right? So I just started thinking, well, maybe I want to do nursing. I just really want to help people, right? But as I got older, I got an opportunity to work front desk at an oral surgery office. I really hated it. Talking to patients about finances is super uncomfortable always. So when they were kind of like, hey, do you want to come to the back? Like, it's super busy today. I went back there and I was like, I'm in love. Just kidding. Not going to be a nurse. And honestly, seeing people lose their teeth really early, seeing people who were going through medical issues and having to lose their teeth, like, it just really brought that fire and that passion of me wanting to be more on the preventative side of things and go into dental hygiene school. So, it was like a little back and forth with nursing, but I'm exactly where I'm supposed to be for sure.
That's so cool. And I love that you talk about preventing losing teeth because I actually just posted a reel on my personal account about like the progression of tooth loss. And all my friends are texting me like, oh no, I've got a bad tooth in the back. Well, we have to help our people,
Yeah, I think people too, like, they don't understand. Losing your teeth is traumatic, and sometimes they don't realize it until they're in the situation getting their tooth pulled and knowing that they don't have anything else to replace it, or the best thing to replace it is super expensive. So, if we can just prevent them from not getting there, we've done our job for sure.
Wonderful. Okay, so it sounds like you worked a little bit before you went to hygiene school. So how old were you when you started the hygiene program?
Oh man, when I started hygiene program, I was 21. So imagine being 21 in Las Vegas and you're like, well, I have no life for the next 2 years. So um, it was just probably a good thing that I was like at that age and I had something to concentrate on versus getting wild in the strip in Las Vegas. But yeah, I started pretty young because when I was working for the oral surgeon, I was around 19 years old. I was taking my prerequisites and, he was kind of working around my college schedule, but he was such a big motivator for me. Like, he's like, I know you can do this. And so I really appreciated him before I started my journey in school. So school was tough as usual, especially, being that age and being away from my friends and my family and, just getting through that. But I actually met my husband in dental hygiene school because I was trying to find a patient. And so I always tell people it's a funny story because I actually went to his house with my tools because I didn't want to take up my clinic time. And I just looked in his mouth while he was there at his house. And I go, wow, it's really brave to go to a stranger's house. But I had sharp tools. So defended myself, but after that, obviously we sparked something from there. But he wasn't, bad enough to be my patient. So that was a good thing. He was too clean.
Okay, good.
Yeah.
That's a good problem.
Yeah. I'm like,
Okay. So you survived dental hygiene school, and now we know you as a leader, a hygiene leader for a very large dental hygiene team. So take us through that. How did you go from graduating clinical hygiene and into a leadership role?
Well, it wasn't easy. Most of my life I've been pretty, I guess sometimes like shy or not really an advocate for others, just like in the background kind of thing. But I think going through dental hygiene school, to be honest, I experienced a lot of discrimination and, um, a lot of unfair things happened to me during hygiene school. And 2 months before I was supposed to graduate, they failed me by 2 points in my test that supposed to like push you through clinic. And so you have to pass it in order to graduate. They failed me by 2 points, and they were saying like, nope, you're out of the program. This is 2 months before I'm almost done with all my patients. And I think that just like really lit a fire in me. And I'm like, no, I'm going to do this. I know that I could do this. And I fought about it. I went to the president and I fought it, and they let me graduate, and I passed my boards with flying colors. And so that, I think, proved to me that sometimes you have to stand up for yourself. And I think I took that approach going into my dental hygiene as a dental hygienist. I knew, okay, I am right. When I see that something's wrong, I'm going to say something. And so I think that leadership just kind of grew in me from there. So I'm kind of thankful for all that. I got into the association during COVID. I really start getting involved because I had the time. And then I just got plunged into the position of president of Nevada Dental Hygienists Association. And I was having imposter syndrome, and I was so scared, but I just knew like, as long as I'm passionate about what I'm doing, I know that I'll do great. And we had an amazing year. Our membership skyrocketed. And a lot of that, I was partnering with my DSO to sponsor some things and working with their regional team. And in doing that, created some good relationships on that regional team. And so when the position of specialty regional manager came up, they reached out to me about it. And, I love clinical. I could do it forever, but I also knew I can't do it forever. So I couldn't just not take the opportunity. But when I took the opportunity, like everything just meshed so well. And I honestly realized like me coaching the hygienist, me collaborating with the periodontist, like I'm treating patients on such a larger mass than what was being done in my operatory. So that really makes me proud. But I really think being a leader in the association really helped me as well with all my leadership skills too.
Oh, Nichelle, I love hearing that so much. I feel like your story just really resonates with me. I feel like you and I are walking the same path. Like, just this year, I mean, just last month, I started being the vice president-elect here in Utah for the association.
Awesome.
I also coach hygienists. Like, I just like, oh my gosh, this is like the other version of like myself in Nevada, just more advanced. I haven't served as president, and so you're just a huge inspiration, not only to me, but I'm sure to many of our listeners. So thank you for that contribution that you made to the association. That is just so high and amazing. I just love hearing it.
Yeah, I mean, it's not something that's easy, and I'm sure as you're going through right now, um, you know, we as hygienists, we have to come together, and I think it's so important that we're involved in our association, because this is how we elevate our role. This is how we progress, and I'm still heavily involved. I just mentored this past president that handed her title over just now in October, and just to watch her grow too and go through, we all need different ideas and different viewpoints in these positions so that we can really grow. And so I'm proud of where we've come from where I started with the association to now it's really growing.
That's really cool. So I don't know if you know, all three of us have left clinical hygiene or in hygiene leadership roles right now. And so we need to take some notes and help each other out, right?
Yeah.
But I know a lot of hygienists are interested in elevating their careers or maybe going into leadership positions. So, in your case, was there anything that you did to prepare yourself for that role? I know you mentioned being involved with the Hygiene Association, but did you do any additional education or did you do anything within your DSO that helped you land that position?
Yeah, I mean, I can say that I'm lucky enough that my DSO, like they are super I mean, education oriented, right? So there's a lot of training on financial reports, analyzing data, pulling out opportunities. It was overwhelming, when I first got into that side of things. I'm like, I don't know these reports. I don't know how to read any of this or analyze it. But as I started to really dive into, we actually have courses on it, we actually have training on it. I felt like it was free college, to be honest, because I'm basically learning the business side of thing, of the top line budget and the bottom line budget and our net profit, and just everything has been so amazing, and I'm loving, and I'm still learning of the business side. But for me, I think it's so cool that we're clinicians in these leadership positions. It's important because we understand what goes on in the trenches, right? So we can be realistic so that when we do find things in a report where we see the opportunities for our hygiene program to grow or to be better, we're able to approach it in a clinical way, and really relate with that clinician, and bring out the why. Because let's face it, a lot of hygienists, sometimes they're not going to be motivated by, oh, well, your office is not hitting budget, right? We can't really say that. But if we see there's an opportunity that maybe we're not diagnosing as much perio as we should be, or maybe we're not using laser therapy the way we should be, and they just need help with their verbiage for acceptance, that's when I can sit down and scrub up and be beside them and review x-rays and prep for their next day and say, hey, here's where the opportunities lie. And really, all of this is the big picture. We're taking care of our patient at the end of the day, and the numbers will come.
Mhm.
Mm-hmm.
That
So, I mean, I just sum it up to, like, I work for a place that really prepares me and continues to help me any way I can.
I'm loving this about you, Nichelle. It sounds like you're the kind of person who starts something first and just figure it out on the way.
Oh yeah.
That's really awesome. And I'm sure your team is really happy to have you. So before we move on to our next topic, I have one more question. So
Sure.
let's say you have a hygienist that you want to motivate them, but they seem a little resistant or unmotivated. What are some things that you do to work with them to try to help get them more engaged?
So one of the things, I mean, since I've been in my role, I obviously, when I stepped into it, I ran into things like this, and I didn't really know the hygienist. So I'm like, oh gosh, well, let's have a one-on-one, just a informal lunch to see, like, same questions. What got you into hygiene? What made, just to kind of see where are their motivators. But I think now, just initially, when I onboard a hygienist, I try to really connect with them, and I try to connect with them on a personal level. That way, if I am seeing that they're not motivated, I already kind of know them or their personality. And there might be something going on at home, right? Or there might be something going on in the office, and I know they're shyer. So I'm going to be like, hey, do you need me to support you on something that you're nervous to talk to the team about? And sometimes it's honestly just observing during the day and observing the interaction between the team and seeing if there's a miss there. But honestly, just connecting with them on a personal level. I try to relate to them. I try to do one-on-ones with them where it's more informal, and it's not, I'm here to like coach you, or I'm here to, tell you how the office is doing. So
Mhm. It's great advice, right, Joffrey?
Oh, I love it.
yeah.
Yes.
Mhm.
Now, Nichelle, do you do quite a bit of traveling with your role?
I do. So sometimes they're busier than others. But I have learned that I have anxiety. I'm like a true crime person. So I like know all the true crime cases. And so the more and more I've traveled by myself, I've been like, oh my God, someone's gonna come kill me. But but other than that, it's been really fun. I've been able to travel. Most of the time I'm honestly just going to like Irvine or some of the California cities. But I've been to like Houston to have dinner with like the endo students there. So sometimes I'll go to just have like resident dinners with people who are graduating like specialty schools like oral surgery, endo, or perio, just to help recruit. And it's really interesting. It's fun to meet the students. They're just as scared as we were coming out of hygiene school. So yeah.
Okay, Nichelle. So one thing that we know that you're very passionate about is diversity and inclusion in dentistry. Can you share with us, some of the ways that you advocate for this, and why this is so important for you to advocate for it?
Yeah, I mean, absolutely. I think, I grew up in Vegas. It was very mixed. So I'm lucky. I grew up around a lot of cultures. But it seemed as though like when I got into college, there was like a flip. And I started to see like, discrimination going on within like myself, kind of I said like when I was in dental hygiene school, just things that were said. And like, we're in our public health class, and they're talking about like, African American patients are always going to be late, or Latino patients are always going to be late to their appointments. And I'm thinking like, no, or there was times where I was pulled aside because I said yeah instead of yes. And they're like, we don't talk slang here. Or one time I had my hood on and they're like, hey, you can't have your hood on. That's ghetto. And just little things that were said to me that I was just like, I've never experienced this on this level. And then looking around and seeing that I'm the only one that looks like me in my class, it was kind of scary. And coming out into getting my license, it was the same thing. There's only 3.7% of dental hygienists that are African American, right? That's a super low percentage. And why, right? And I think it's an awareness thing. My sister works for the school district, so one of my big projects I want to do next spring is to get out to these high schools where there are more brown and black students, and make them aware of like this amazing career that they could have. Me just being in clinical as a hygienist, and I don't know, Olivia, maybe you've experienced this before, but as a hygienist, I literally would have patients come see me because I'm African American and they just felt more comfortable. I think, we have to be transparent and call it like it is that a lot of black and brown patients do not trust doctors that don't look like them. So it's really important that we are in the offices advocating that everything's okay. They can trust us. They can trust the treatment plan so that they do accept treatment and they are healthier. So I think it's important that we represent in that way. Since I've been in this role, I've noticed that we've had a lot of black and brown hygienists gravitate to our DSO because I am over it. And then and they've talked to me about it in the interview of like, I'm really happy to see an African American person in this role. I want to work with you. I feel comfortable with you. So I love that because now they're going to go out into the offices and, if they have patients that are black and brown, they're probably going to be a little bit more trusting of their treatment plan. Last year, I was able to connect with Brown Girl RDH, which is run by Martel Koch. It's such an amazing organization, nonprofit that gives out scholarships to minority students, or honestly just any color of low income students, so we can get them into these schools and get them graduated and, give them their license. So, honestly, just me being in this leadership role and representing in this way, I think that has been a really good inspiration for a lot of people. So I mean, I love being in this role, but that's like the biggest thing that I love about it is just inspiring other people that look like me.
Yeah. And, I want to touch on something you said about patients feeling comfortable with a healthcare provider that looks like them. And sometimes people can hear that and they think, oh, they're being racist. But there's actually studies showing that just sometimes when they speak up and say, I'm in pain, they're not always taken seriously. They're not offered pain medication as much as other patients. Or maybe they're given a lower treatment plan because their provider might assume they can't afford this. So let me just give them a denture and not even tell them about implants. So it's not that the patients are racist, right? It's that they want to be treated in the same as any other patient. And so by us being available and educating our community and being there to help them, it helps increase access to care. And then there's so many great providers that may not look like them, but they learn from the way that we treat them that, hey, okay, when I interact with this population, I should treat them the same as everyone else. I actually ended up leaving an office because I noticed that the doctor was catering treatment plans based on the way people looked. And it was so unfortunate because he was a great doctor, but I tried speaking up and, mentioning it, and it didn't really go anywhere. So I was like, okay, I can't support this practice in that way. So we just have to try our best to help patients feel comfortable and have better access to care. So I'm really happy that you are.
And it's funny that you say that, because I did like have a couple of coworkers be like, well, this patient literally just came in and was like, I want to see Black hygienists only, and I get how that can come off like, oh, like, if a patient came in and said the other way around, I'd be like, oh my God, right? But I think we just have to acknowledge that there's been generations of instances where, obviously Black and brown people weren't treated the way they should be, especially in the medical field. They were experimented on. You hear stories about, slaves getting their teeth pulled and the slave owner taking them as for themselves. So just like different things throughout the generations, you think about grandparent to child. There's just that distrust generation after generation. And I've worked for many doctors that never ever discriminate or do anything, but like you said, I have experienced those kind of situations where they're not being presented the same treatment or even treated the same just because of the color of their skin, which is unfortunate. And even myself, I've gone through that. My woman's doctor basically treated me like that because they thought that I wasn't educated, and it was really, really unsettling and not a good experience. So we just have to think about and sympathize with maybe they've experienced before.
Yeah, it makes me think, when I was in clinic just a few months ago, I was a hygienist here in Park City, Utah, and we have a very high Latino community in Park City. And my patients, they don't know, like, my married name is Herrera. They just don't see me as a Herrera, right? And I don't speak Spanish, and so I would treatment plan my patients all the same, right? Like, no matter what color they are. But what I want to get to, the point is that my front office, Maria, she spoke Spanish as a Latino woman, and she would close all my treatment cases for me for these Latino patients because they trusted her, who has no hygiene education, over me. So Maria and I had a great system. I'm like, okay, I have said everything I can, and now I need you to reiterate it. And then she would, but they trusted Maria more than they would trust me. And I was just so grateful to even have her on my team to do that for the community, because I couldn't close it myself, and they really needed that treatment. So I leaned on her more than, and appreciated her more than she probably would ever know.
I love that.
Yeah.
And that's why, like, specifically out here in Las Vegas, like when I go to my offices, I just love that there's just such a big mix of cultures. I mean, we have doctors and like front desk people that speak Chinese, they speak Tagalog, and like you said, like people want to go somewhere and feel comfortable. So I just think that's amazing,
Definitely. So I want to ask you, I'm with the 2 DSO girls right now. So in my 16 years of clinical hygiene. I've never worked for a DSO. I've always had the impression that if I'm in a DSO, I'll have to fight a lot of red tape to get what I want, if I want new tools, or if I want to practice a certain way, it may be a little bit harder to have my clinical autonomy. So do you think my prejudice against DSOs is warranted, or is there a way for hygienists to have autonomy within a DSO?
Yeah, I mean, that's an amazing question because when I got out of school, I was like, I will never ever work for a DSO. I had heard so many terrible things, right? And I worked private for about 7 years before I went to my DSO, and really went there because I was like, I need insurance and I need a retirement plan, work-life balance. And the day that I was hired there, I told my husband, I'm gonna quit in a week if they're crazy, basically. But what I did learn was that every DSO is different. A big thing that drew me to this particular one was that the doctor actually owned part of it and it was a partnership. So the clinical culture is set by the doctor. So as long as you're clinically aligned with the doctor, you should be fine. But I think there is a misconception because in the past, a lot of DSOs were run by businessmen, businesswomen, right? And everything was numbers, numbers, numbers. How can we make this profitable? How many patients can we see in one day? And I think they started to realize that they're not getting the best of the best because that's not how people want to work. So I think there was a change at some point where things have changed. And from my experience and what I've experienced the past 8 years, the autonomy is way there. Like it's there more than it was in private practice. In my private practices, I always felt like an employee, right? But here to hear like, no, you're a specialist here, you're a provider here. You dictate your schedule. You let us know how long this is going to take. You collaborate and are expected to collaborate with the dentist and the periodontist on the treatment plan and managing the periodontal disease for this patient. And I have run into hygienists who are like, you know what, I really just don't believe in laser therapy, right? And so our question is, okay, what do you believe in? Okay, well, I believe in Arrestin, or I've had really good experiences with maybe using the medicated trays. So whatever works for that clinician, we do try to respect that and want them to work how they feel comfortable working because they're the one rendering those services. So it was the opposite for me, and I kind of was like, wow, I could have been here a long time ago because I'm actually practicing how I always wanted to practice. In my private practices, like I didn't have a periodontist coming to my office teaching me about perio so I can take care of my patients. I didn't have the doctor asking me, hey, can you come probe this patient and let me know what you think the treatment plan should be? That wasn't happening at all. So it's encouraged actually, where I'm at. So I just think it's a different level of how your role is when you're in a DSL. You're more of a provider.
Beautiful.
I have to agree with that, like 1,000%, like 1,000%. I agree with that. And, I want to add too, if you're working for a DSO, there's a really high chance that you have somebody like myself or Nichelle backing you up. If you need support on something, if there's a problem, we are here to advocate and to support the hygienist. And you're not going to find that in a private practice. You don't have somebody with a voice quite like mine or Nichelle's. Like we're here to get stuff done, and we're here to advocate for those hygienists. And not only are we advocating for the hygienists, we are also advocating for the patients. And you don't see that in private practices either, where we are ensuring a high level of care is being implemented across all of our clinics. And as a DSO, there's so much more red tape for us that I don't think people realize. Like we are under a larger microscope than a private practice on what kind of care are we giving to our patients. And so we are really top tier when it comes to standard of care. Like there are no shortcuts because there are people like Nichelle and myself making sure that every patient is getting the care that they deserve. And I just feel so passionate about what we are doing and what we are bringing to the table that I'm like, private practice can't match what we have. It is really
Olivia's like, okay, I get it.
Okay.
No, definitely. I love that you brought that up. I forgot to mention that is like the way that I work is I try to be who I wouldn't thought I needed when I was in private, because there were so many times, and I'm sure you've been through it before, where like unethical things are happening, our infection control breaches are happening, and there's nobody to really reach out to or like talk to about. There's no HR, and it's hard. So the things that I've been able to solve, and I'm sure Joffrey, you've been able to solve for a hygienist, or even having to move a hygienist and say, hey, this is a better fit for you in this office, and seeing them like blossom from there. It makes me feel really great that we're able to be there, kind of like a check and balances situation. And that's another thing. I never worked for some place that was so clean. I was like, oh my gosh, I feel very comfortable sending my family here. Like, because like she said, our board holds us to like very high standards. So when they come in for our new offices, they really make sure that everything is on point. And we even have somebody for that, to make sure our water's being tested every month, to make sure the infection control is there. We have infection control every year that we provide. So it's just like, very clean.
You guys are on it. That's beautiful.
All right. So Nichelle, we're curious, is there a balance between clinical autonomy and having a standard of care to make sure patients are receiving the best care? Kind of what we were just talking about, really. But what are some things your team does for periodontal care?
The way that we approach periodontal care, I think it differs probably from a lot of other offices. I don't know, you can tell me. But we're very oral systemic link centric, mouth body connection, right? So when our patients walk through the door, automatically we're taking their medical and their dental insurance, making sure they understand that, there may be some things that are considered medically necessary here, just to get them thinking like this is all connected, right? But beyond that, when we go in for the probe, again, we do like our hygienists to go in there and probe and collaborate with the doctors, especially our new associates who had a little bit experience at probing. But we have them go in, right, and talk to the patient about everything. But we really train them to understand the link between, if they're looking at their medical history and they're seeing certain medications or certain conditions, we're going to talk to the patient about that and how it's related to their periodontal disease. And then we take it a step forward, and we will present to them lab testing for their saliva, so that they understand these pathogens that are hurting your gums, causing bone loss. These are also related to some really serious systemic diseases that you may already have or be really high risk for. And so when the patient is able to get those results and see those levels, it really just speaks volumes that we're not just scraping teeth here. We're managing a disease that cannot be really cured. We're just maintaining things and treating you this way. So that the patient really understands the value. And in the past, I did like a case study contest with my hygienist. And so one of our top winners, we had a patient who did the salivary diagnostic testing. Her FN, which is related to preterm birth, was just off the charts as far as the level it was on before scaling and replaning. And she had mentioned that she had miscarriages. She was not able to conceive, and after this. And so after treating her and then doing period maintenances and doing laser therapy to keep that bacterial load down, she ended up getting pregnant and having a healthy baby. So when we're able to really give these patients that information, it's that much more of like value for them to come back and to really maintain their oral health. And I have like a million stories like that when it comes to salivary diagnostic. But not everyone is able to maintain things at home either. So we do like to, right now I'm partnering with Arcline. They have a product called Gum Hero. It's a home system care. Well, basically we have custom trays made for the patient. They're able to put some medicated gel in there and just wear it for 15 minutes a day. I'm a solution-oriented hygienist. And when you have patients that can't afford perio surgery, right? or they're medically compromised and can't get perio surgery, or maybe it's dexterity, maybe they have Parkinson's disease, maybe they're special needs. Like, I want to give them a solution to help them at home. And so having those trays that can that you can put medication in them, and they kill those harmful bacteria that they can't reach, right? We know they can floss, brush 3 millimeters, but if that medication can get down deeper in there, kill the harmful bacteria while we're trying to maintain things, I think it's just a phenomenal solution as well. So I'm really excited to partner with them, so we can get a solution out there for our patients.
Okay, so to be honest with you, I had never heard of them before,
Mm-hmm.
but I know there's some other brands with like similar products or similar gels. So what makes them different?
So I've tried to partner with other companies like this. What makes them actually really different is their cutting technology. Like, right, they do 3D models. You're able to scan 3D, send it in. So these trays are going to be really customary, right? They're going to fit the patient really well. And that way, there's very small room for error for the patient not to get that medication in the right areas it needs to be. So that's one thing. It's just the technology that they use and the computer assisted design they use to make sure the trays are super customary. I did love their lab fees because they're a lot lower than what I've seen before. But also, I really love how hands-on they've been. So they're willing to come out and do training, work with your clinicians on verbiage, work with them on identifying who these candidates would look like. Right now, I'm starting a case study and I'm really excited about it, because my stepfather has moderate to advanced perio and he also has diabetes, and his HbA1c is like 8 and 9. It fluctuates, right? And so I can't really send him for surgery with the periodontist because the healing just won't be there with those kind of numbers. So I'm going to have them start using these trays at home. And my hope is that we all know that uncontrolled diabetes, uncontrolled perio, they just kind of coincide with each other. If we can get the perio under control, I'm hoping to see that HbA1c number go down. Within my DSO, we do have medical and dental integrated practices, and they're really amazing because those patients that come in with high blood pressure, we can automatically just say, hey, we have medical right next door. Let's bring our physician, our NPN, to analyze, what's going on. But we also have HbA1c machines. So we're able to test our new patients. What we found last year was that 33% of our patients were pre-diabetic or diabetic and didn't know it. We all know our patients come see us when they're in pain or when they just want bright white teeth, right? So if we can, it's just like blood pressure, right? How many patients do you take blood pressure on? Haven't been their physician in years, like, you have high blood pressure. So us having those machines in our office, we do want to catch that because it's really, really important if we know, okay, this person has diabetes. This explains the uncontrolled perio. So yeah, I know that was a long rant, but that's what kind of differentiates them, is that they're super hands-on and the technology is there so that there's very little room for error.
Yeah. Well, I'm excited to reach out to them and find out what the lab fee is, because we do use a similar product in my office, but the lab fee is quite high. So if we can make it more affordable for patients, that means more patients can get it. Yes, I'll be emailing them later.
Mm-hmm. Yeah, and like, I don't know if you guys experienced this in the past, but like there's been times where before I came over the DSO, like patients just couldn't afford things, and it's just like, okay, bye, you're like, wow, that sucks. Like they really needed the treatment. But with, where I'm at now, we're able to offer them like payment of a vast amount of payment options. And sometimes we just discount it, or sometimes we just do it, right? Because it's the right thing to do. So it is helpful that the lab fees are lower so we can tailor to people who can't really afford it otherwise.
It's so nice.
You make me want to have this gum hero in my clinics and in my
I'm
DSO.
really excited about it.
Hearing you talk about the case study you plan on doing with your stepfather, I would love to do a case study on my sister. So she has Sjogren's, and And that is linked with her lupus, but she was diagnosed as a 10-year-old, and most women are diagnosed in their like 30s or 40s with lupus. And so her journey with Sjogren's, she has lost so many teeth and she has had implants fail. And so her bone loss is like not necessarily contributed from periodontal disease, but her bone loss is contributed from like tooth loss and from the decay and just all these things that have gone so south for her. I would just I have to do it now. I'm tired. I have to figure my sister out.
Right. And honestly, I think she would be a good place to do. Yes. That's what I was gonna say, Olivia. Like saliva test first and see what's going on, what pathogens are there, and then go from there.
So with the Gum Hero, how is this product changing the way that the periodontal management approach?
So for me, we know our patients don't do what they're supposed to do all the time at home.
No, not my patients.
And they have all these excuses of why they can't floss, why they're I mean, the best excuse I got, one of the hygienists, like, this patient just told me that she's too dehydrated to floss right now. What? Yes, we live in Las Vegas. It's super hot. I get it. We're tired, but really, like, come on. So, so it's not just those cases I talked about where, there's a situation where we really just need to be aggressive and, they just kind of fall into that line where they can't get surgery. But even honestly, like, I have the trays right now and I'm super excited because I had a couple of 4s and I was like freaking out. Just for patients who want healthier mouths, right? So if we're able to not only brush, floss, maybe we don't floss as much, but we have this medicated a home system where we can kill the really harmful pathogens that are causing bleeding, that are causing inflammation, causing bone loss. It really can just help the management at home, because that's really, and we talk to our patients about it too. You do that scaling and root planing, you do your laser therapy, you tell them how important it is to do the right things at home, but life happens and it doesn't always work out for them if they're having dexterity problems or maybe they're elderly or, there's so many cases. So just making sure that we're doing everything to help them at home to maintain, this disease is really changing the game. Now we have something else, a solution.
Yeah. And you know what I found, with putting patients on tray systems, maybe they start it hesitantly and then they get like, oh, I can't go without it because their breath is fresher. Their teeth are whiter. And when you tell them 15 minutes at first, they're like, what? But I just tell them wear it when you're in the shower or when you're washing dishes, or when you're watching a TV show, like double up so that way it's easy. It doesn't feel like this huge extra thing to do. And the patients end up really loving it. So it's good.
It becomes a good habit.
Okay, so if any of us wanted to find out about using Gum Hero in our office or find out about the lab fees, or like, do you need a special scanner? Like, how do you get started?
Well, honestly, you can use anything as far as impressions. If you have a digital scanner, great for the patient. We all like using that versus regular impressions, but you can do regular impressions too. So either or you can do, and just making sure the impressions are good enough, at least 4 millimeters below the gum line, so that we know that medication will be able to get down where it needs to go. But afterwards, you can actually go to app.arcline.com to prescribe the trays to your patient. They'll take care of everything from there. If you just want to learn more about it, you can go to arcline.com. That's ARKLIGN.com. And then you can just register. They're really great. They're really hands-on, like I said, and they can just give you all the information you need as far as like lab costs and the process. So they're just very hands-on and they'll be great partners with you.
Okay, thank you so much.
Okay, so we have, okay, let me start that over again. Okay, so we see that you've been able to volunteer internationally. So let's switch the conversation just a little bit. Can you tell us about your experience internationally?
Yeah, that experience just like, I feel like it's like life-changing, right? it's something I've always wanted to do. And again, I partnered up with Brown RDH and was one of their ambassadors last year, which is a really great opportunity. And they actually are the ones that connected me with the Jamaican Outreach Program. And it's actually a church and a school that has a clinic, a dental clinic on their premises. So me and the 2023-2024 Nevada Dental Hygienist President went out there, and we saw like about 200 patients within the course of like 2.5 days. We were so tired. We were working like 12-hour days, but just the reaction, the gratefulness from the patients. I brought like little toys and hairpins and headbands for the kids, and they were so appreciative, and we did some oral health education, and like just seeing what they take as such a privilege to get dental care. I'm always knew that if I ever did it non-clinical, that I would use my clinical skills to help other people for free. So it was just such an amazing experience that it inspired me. And so now I just started my own nonprofit, and it's called RDH Humanitarian Project.
What?
And
I didn't know this.
so excited.
Awesome.
It's very new. I have like 4 followers on Instagram right now.
Oh, I'm gonna change it today. I'm gonna follow you right now.
Same. I'm following her too.
And so I'm so excited because my first project is I have a meeting next week with the medical volunteers of Southern Nevada. And so they actually have some dental clinics where they're at. And what they do is they treat patients who kind of fall through the loopholes that don't necessarily can get like state funded dental insurance. Maybe they're undocumented. There's a lot of reasons. A lot of patients with mental illness, a lot of patients who don't qualify for VA insurance but are veterans. So I'm really excited to partner with them and get some volunteers out there to start helping access to care. My ultimate goal is to raise funds so that I can send people to mission trips, across the world. Right now, I might be going to Pakistan sometime next year. We'll see. But I'm really excited about it. So I just really feel passionate about helping other people. If you have those skills, put them to use in a good way. Yeah.
Okay, I have to interject here. Olivia, earlier in the conversation, you had asked her like what kind of skills she had done to land the position she currently has. It is like her heart. Her heart is so big and for all these people. That is the secret sauce. That is what makes Nichelle. Wow.
Oh, thank you.
Yeah, I have to say, I'm just so proud of you. I don't know you that well, but I'm really proud of you. Thank you so much for all you're doing for people. You're changing lives, and it's a beautiful thing. And I actually started following you because I saw that your office did local volunteer work, and I started planning 2 years ago volunteer days within my office. And actually, it's funny, it was a struggle for us to get patients to come in to get free dental care. And so I reached out to you like, okay, how did you do this? So can you tell us a little bit about what goes on behind the scenes to plan a volunteer day? How do you get the staff to agree? How do you get patients in? And just help out anybody else who may want to do something similar.
Yeah. So, I mean, the first thing is you're going to have to find a dentist that really loves you and cares about the community. And it's going to open up their office and let you use all their supplies for free for a day, and also help participate as well. But I would put together almost a proposal before that. In all of wherever you're at, you're going to find that there are a lot of organizations in need of this. So whether it's like a women's shelter, whether it's, out here we have Nevada, New Nevadans, and it's like for refugees, they just help them kind of get on their feet when they come here. And also I think most of the states have like a Catholic charity. So reaching out to those kind of organizations. This past year, we worked with After Innocence, which is people who have been wrongly accused for crimes and been released, and helping them get on their feet. So reach out to those organizations and find out who needs dental care in those organizations first. Then go to the doctor and say, hey, I have all these organizations, they really need help. Would you be willing to sacrifice a day of, of care where you would be rendering services, me, and really we want to do priority. We're not going to, do any kind of rehab. It's like, this is the worst tooth, it's going, or this is the worst tooth, let me do a crown. We'll do the scaling and root planing. We'll definitely take care of the hygiene part. But also remind your dentist that they can write all this off. So even just utilizing their software, utilizing their venue, utilizing their materials, they can write all that off and tell them like, hey, I'm going to bring the news out, let's get the word out. And, usually they will like that kind of stuff. We've actually gotten patients that came to our office because they saw us on the news and saw we're doing good things, and they just trusted us after that. So I would say that's the best way, is to find some organizations that are really, really in need and present it to the doctor and let them know what, it's not just benefiting the patient, it's going to help your practice, to be honest. So it's a
Definitely.
win-win.
Yeah, I find the patients that are aware that we do volunteer care in our office, they just love us more. They feel more attached to us, and they feel like they're supporting a good cause by being a patient in the office is also kind of their way of giving back as well. So we've actually seen our patients become very, very loyal to us. And even when we would do mission trips as an office, oftentimes our patients would support like with the GoFundMe and everything. So I think it's also great tapping into your patients and see how they can help, even though they're not a dental professional, they care too. So some really great tips there. Thank you.
That is such great advice on getting those free dental days started and ramped up. And thank you for sharing that. I would love to give you a little chance to make a plug-in for the association and share your passion about being a member. Go right ahead.
Yes. She's like, let's, yeah. So honestly, when you think back on how much and where we've come from, like we've done so much as, just a profession. And so honestly, just that right there should help you understand the importance of the association. I think a lot of times what I get is like, well, what is the money? Where does the money go? Like, I don't get it, right? And it's like, well, this money goes for our lobbyists, right? It goes to keep the association running. But for us in particular, we do have a lobbyist that has done some really great groundwork for us with helping connect us with the important stakeholders on certain legislations that we want to move forward with. So without that funding, we're not able to have these important people in high places that can help us push things forward. And also it's just a sense of community and voice. This is your profession. If you are passionate about something, we need to know about it. Maybe it's something we haven't thought about and something we want to pass legislatively, So just us all together, staying together. I was just at the CDHA event last week. They do such an amazing job as well. They've done so much, they've progressed so much. They're like literally somebody, a group I look up to, because, their dental hygienists can work on their own in rural areas and help people who really need it. So I would just say, if you want to keep your license and and practice on the scope of care that you deserve with your education experience, you definitely should be a part of your association and support us.
Very, very good.
Yeah.
All right, Nichelle, you're doing amazing things. You've done amazing things. But if you could go back to Nichelle, the new grad RDH, what would you tell her? What advice would you give?
Well, you guys heard my nightmare story. So, I wouldn't change anything about it, because obviously it brought me to where I am right now and really lit a fire under me. But what I would probably tell myself though is, you know, what happens in school, the grades you get, how you exit school, how you graduate does not dictate what your professional future is going to be. So if you are in school and you're struggling, or you weren't the best student, that doesn't mean that you're not going to be the best clinician, or you're not going to be a leader. Like, if you look at my story, you think, oh my God, like she failed out of dental hygiene school. She had to fight her way back in, right? All of that is just a part of your journey. Because when I came out of school, all of that made me feel like I wasn't a good hygienist. Even though I passed my boards and everything, I just wasn't that confident in myself when I got out of school. I always just thought, like, was I supposed to get this license? Like, am I a good clinician? But just don't let any of that, what happens in school, dictate how you're going to practice and who you're going to be.
That's really good advice.
I know, I love that. Thinking back to like my own time in hygiene school, I actually felt like such an outsider and like judged by my peers for being an unmarried mom. When I started hygiene program, my daughter was 6 months old, and you can just feel that judgment. It's there. And
well, God bless you for getting through school with
I know, right? We all have our own journeys, and I remember, the school that I went to was in like a very religious community, and I just was definitely seen as like not one of them. And so I just love hearing you say that, because I'm like, yeah, it's just, you just get through it.
Yeah. Look at where you're at today, right? But in the moment, it's like, oh my God, like.
And your patients don't know and will never care. But it's funny, I almost failed out of dental hygiene too. But I always felt like a great hygienist clinically, but I was very young. I was 20 when I graduated the program.
Oh my God.
And the reason I almost failed was because one day I was like on sterilization, and I was supposed to sterilize a whole bunch of cotton gauze for like something else, and I didn't do it. And I'm like, wait, I did all of this for these past couple of years, and I have great grades. I finished my clinical things, and I'm really going to not graduate because of that. And so my teachers met, and it was like a whole big thing. And finally, they decided to let me graduate, but also I had to fight for it. And I couldn't believe it. But I feel like they make hygiene school so unnecessarily stressful.
Yeah.
It's like, yes, our job is hard, but it doesn't have to be this hard.
No, and that's the thing too, like, and I'm sure Joffrey too, like, I get these new grads, and I just got my round of new grads, and I feel like my job has been to like honestly be like, you're amazing, you're great, you can do this, and like pump them back up, because you can see it in their face. They're so defeated because of, in hygiene school, they just make it so, painfully difficult, right? And you don't feel like, woohoo, I got my license, I'm confident, I should have this license, right? So it's just funny that you say that. We all trauma bond over it.
Well, and the reflections afterwards, right? Like, you just made it through this incredibly challenging program. And in that program, I had one instructor who was so strict on everything. Like, what color are your socks? And let me see your fingernails. And did you scrub the foot pedal before we closed up today? Like, so incredibly hard. And when I look back at it now, a decade later, I'm almost grateful for some of that harshness, because that instructor has no idea what a clinician she created, because I am so clean with all my stuff, and I am the way that I am because of her. And so there are some aspects of that, like, rigorous, that I appreciate, but some of it was like just a little too extreme,
like over the top a little bit.
You had to wear khaki scrubs. You could only wear khaki scrubs. And at that time was when Orange is the New Black was really popular. So it really just made us all feel like inmates.
You guys were prisoners. Oh, it's terrible.
All right, but last question here, Nichelle. What is something you wished you learned in school that took you a long time to figure out?
That's a good question. Patients are mean. So I didn't necessarily feel confident when patients were mean, or they just straight up is like, I'm not going to do this treatment. So I kind of almost feel like there should be some kind of like case acceptance course or patient communication course where we understand how to overcome objections and how to talk to patients in difficult moments. Like, I was a server and a bartender, and I dealt with very mean people, but I guess I just felt like it was expected, and I'm just kind of like, whatever, you know. But when you get in that professional realm and you're the professional with the license and they come at you like, no, I'm not doing that. You know, I'm just going to get a regular cleaning. And you're like, oh, I don't know how to handle this, you know. A lot of what I do with our new hygienists coming out of school that come to us, that's what we train on. Our hygiene boot camp, a lot of it is patient interaction, patient acceptance, how to talk to patients. So really wish we could have went through that in school. I've had a lot of patients, you know, get crazy with me in the beginning, and you're just kind of like, okay, you're like running at your doctor, like, oh, I don't want to see this patient, you know. So I think that'd have been great.
Yeah.
I love you saying that. I feel that. Oh my gosh, that is something.
You just remember those moments where you're a new hygienist and they're like, "Are you new? I'm used to seeing this person," and like, and you're just like, you know.
And listen, now they better not test me. I just
Exactly. I will tilt your chair up in a hot second.
Learned. I have grown. You know, I have to tell you this story. It's hilarious. This like, I think she was maybe 14, 15 years old, this teenage girl. And I'll let patients be on their phones. I don't care anymore, you know. So if you just keep your mouth open and let me scale, you can be on your phone. I don't care. I used to get offended, not anymore. Now, so she was on her phone and she was on Snapchat, and she snaps a picture of her and I. And I'm like, oh, cute. You know, they all do that. They all share selfies in the dental chair. She captioned it, "This bee is making my gums bleed."
Oh my God.
I was like, and at 10 years in my career, I am like, pause. Nope. Sat the chair up.
Brave.
Looked at her square in the face and said, "Your gums are bleeding because you are not brushing and flossing at home."
Exactly.
And the look on, she was mortified. She was like, "Oh my gosh."
You're like, let me see that about Snapchat.
Jeffrey, that is so funny. I cannot think it.
I went up to the front and I called her mother. And I told her mom what she did. And I said, "Hey, listen, this is so disrespectful. If you guys want your daughter to be seen in this clinic, she cannot behave like this in my chair."
Oh my
and
God.
That girl had no idea I called and ratted her out to her mom until she got home. And I'm like, Joffrey does not play, not anymore.
Yeah, exactly. You get to the point where you're like, no, I won't stand for this.
No, I'm like, I will dismiss a patient for that kind of rudeness. I'm like, no way.
And having a doctor that will back you up and allow you to do that, what a blessing, what a beautiful thing. Oh my goodness. Well, Nichelle, this was such a pleasure and so fun to talk to you today. So thank you so much for joining us here at Hygiene Elevated.
Thank you guys so
your
much.
insight is so valuable. Anybody listening to this episode is going to take something away. We covered so many amazing points in this episode today. So just thank you so much, Nichelle.
Yeah, thank you guys for the opportunity. And then also, you know, be on the lookout for my nonprofit, because hopefully down the road I'll be giving out scholarships for mission trips and making the world a better place, like Geoffrey said. So thank you guys so much.
Absolutely.